We have a referral from Dr. Lankowitz.
Don't know him.
He knows you.
What's the problem?
Heart attack.
Definitely don't know him.
The patient's 10.
10-year-olds do not have heart attacks. It's got to be a mistake.
Right. Simplest explanation is she's a 40-year-old lying about her age. Maybe an actress trying to hang on.
I meant maybe the tests were wrong.
That's what the ER thought. 3 CKMBs were positive. The EKG shows classic signs of ST elevation. It's a heart attack.
She's morbidly obese. The morbid part of that raises alarms.
Come on, it takes decades to eat your way into a heart attack.
Doesn't take decades to kill yourself. If I was that fat, I'd be pretty tempted to knock back a bottle of pills.
It's not a drug overdose. The fatigue, muscle pain, and difficulty concentrating have been bothering her for over a year.
That's because of her weight, because of her depression.
That's what 5 pediatricians, 2 nutritionists, and a psychologist said. The heart attack would seem to indicate that they missed something.
It's got to be something genetic.
What about metabolic syndrome X?
Insulin resistance?
Syndrome X could cause a stroke. I don't know about a heart attack.
Could, if her blood pressure was high enough.
Which is likely considering her weight.
Fits the symptoms. Me likey to a hyperinsulinemic euglycemic clamp.
She's diabetic?
No, but it's similar. MSX patients don't respond normally to insulin, which causes their body to create too much, and that leads to metabolic abnormalities. We're going to do a test to be sure, but there are certain dangers.
Is this thing treatable?
It's controllable through proper diet and exercise.
Wait. Jessica already eats right, and she exercises every day.
I know you've already seen several nutritionists.
And we've done everything they've recommended.
I understand,
Why
but...
can't any of you doctors see past her weight? If diet and exercise are the treatment, then the diagnosis is wrong.
It might be. But the only way we'll know is if you let us do this test.
I don't want to.
The test involves some pretty precise measurements. If we don't know exactly how much you weigh, we won't get the right answers.
Let me tell you a secret. When I was your age, I was heavy too.
Were you over 100?
Way over. Kids in my neighborhood used to call me Rerun.
Rerun?
He was a heavy guy from TV. And I used to pretend I liked it, but I didn't.
How come you're not heavy anymore?
9th grade, grew 5 inches, everything kind of evened out.
You think that'll happen to me?
Well, yeah. I mean, your mom's tall, and you are a little short for your age. Probably spring right up.
Increasing glucose to 6.9 milligrams per minute.
Are you okay?
I'm thirsty.
Just a little bit longer and you'll be done.
Like Dr. Chase.
Want to put some money on it?
I said I'm thirsty.
Just 5 more minutes, okay, sweetheart?
I'm not your sweetheart. Don't call me that.
Jessica, that's not nice.
They're the ones who aren't nice.
Jessica.
You're not either. I don't want to do this anymore.
Jessica! Jessica, you have to calm down.
Let me go!
Check her blood sugar. She's got to be getting hypoglycemia.
Never seen her like this before.
Hey, calm down.
Oh, me! Get it out of me! Oh, you son of a bitch! You bastard!
She's sedated. Mrs. Sims, don't worry. Hypoglycemia can cause temporary psychosis and is a common complication during an AGC procedure.
I never wanted it done in the first place.
We understand you're upset, but we
You were supposed to be monitoring her condition, but instead you were bickering and placing bets.
I apologize if it looked like we weren't devoting our full attention to your daughter, but I assure you that we...
Oh, please, save your pathetic insincerity for your boyfriend.
You're wrong. She is, in fact, pathetically sincere. And they didn't screw it up.
Who are you?
I'm from the lab. The blood tests show your daughter was not hypoglycemic, which means her psychosis wasn't caused by anything these doctors did.
So then what was it caused by?
I have no idea. But you'll be happy to hear it cannot be cured by diet or exercise. What else could cause uncontrollable rage in a 10-year-old?
Nothing that could also cause a heart attack.
I assume I don't have to point out that now would be an extremely good time for one of you to distinguish yourself with a brilliant idea.
A hypercoagulable state can cause a blood clot. Blood clots can cause a heart attack.
More likely to cause a stroke, not the psychosis.
No, you're wrong. If a clot made it to the amygdala area of the brain, it might cause uncontrollable rage.
Right, because anything's possible, but nothing's gonna cause multiple clots in a kid this age.
She's fat.
Obesity doesn't cause blood clots.
Extremely obese patients can get a fat embolus.
Right, after they've had liposuction, which she's clearly never had.
How do you know?
Because we have her medical records. And because no plastic surgeon in his right mind is gonna give a 10-year-old liposuction.
Have you ever met a plastic surgeon who was in their right mind?
She hasn't had liposuction.
Thank you.
But what about some other ridiculous obesity treatment?
Like what?
Diet pills can cause heart attacks and blood clots.
Her tox screen was negative.
Wouldn't show over-the-counter weight loss drugs.
Her mother wouldn't give her diet pills.
Yeah, she thinks her daughter's perfect just the way she is.
She's lying. Okay, you two, heparin and warfarin to prevent further clotting. And you find those pills.
I didn't give her diet pills. I would never do that.
Right, so it was her imaginary mom.
She didn't take any pills. The girl's lying.
Why would she lie?
Because she's another mean little jerk?
Mom,
I'm sorry, honey.
Clemmy didn't lie. I did. I took the pills. I told her you gave them to me because I didn't want to get in trouble.
Where did you get them?
I took them from the store.
Why? Why would you do that?
Because I didn't want to be ugly anymore.
Oh, baby, you're not ugly.
Yes, I am. I know you don't think so, but I am. I'm disgusting.
Jessica, please don't say that.
I just wanted to fit in. You know, have friends. Or at least have one person my age be nice to me.
Oh.
Listen, the pills cause blood clots, heart attacks, and insomnia. It explains everything. We'll keep her overnight to make sure, but she'll be fine.
Thank you. It hurts so bad.
What happened?
Please. She's bleeding.
From where?
Oh my gosh. Oh, just please stop it, please. God.
Diet pills don't cause skin necrosis.
Could be something related to the pills.
Or not.
Or both. Diet pills brought her to us. We gave her the sores.
You think she got a staph infection from something here?
I'm not saying the hospital gave the sores, I'm saying we did, by treating her. Warfarin-induced skin necrosis.
Highly unlikely. We started her on heparin before the warfarin.
Who gave her the heparin?
I did warfarin, she did heparin.
Sure you didn't both give her warfarin?
Yes, I did not screw up.
Did you actually see her prepare and administer the heparin? Enough said.
You were standing right there.
I was preparing my own dose.
Yeah, right. There's got to be some other cause.
None that I can think of. Let's fix the mistake. Give her unfractionated IV heparin and low molecular weight heparin by subcutaneous injection, stat.
It's been almost 3 hours. Still not changing air conditioning.
I think we should get her into surgery.
So what do you want to do?
Assume that Cameron didn't screw up.
What if it's not the warfarin?
It has to be. The sores presented right after we administered.
Right. But let's just say it's not. Come on, what do you got?
Can I have a second to think?
No, there's no time to think. Just say the first thing that comes into your head.
She's fat.
Enough already, okay? We got it. You hate fat people.
That's not what I meant.
We already considered obesity as a cause.
So did all our other doctors.
No, I mean, what if it's not a cause? What if it's a symptom?
Okay, so what could cause obesity and skin necrosis? Listen, I don't care if it makes sense. Just give me something.
Ulcers secondary to vasculitis.
No, that's just sores, not obesity.
Pyoderma gangrenosum.
More sores. Okay, let's look at it from the other side. What has obesity as a symptom?
Hypothyroidism.
Genetics are more likely. Her mom's heavy, too.
She's not just heavy. She's tall. You have any history on the dad?
Yeah. 6'1".
Kid's short. We've got stunted growth, high blood pressure, blood clots, obesity. It's Cushing's.
No. Necrosis doesn't present.
In rare cases, Cushing's can cause hypercalcemia, which can lead to the same skin necrosis as warfarin. It's perfect. It explains everything.
Except it's not Cushing's. She's had multiple blood tests, and none show abnormal cortisol levels.
The hypercortisolism could be cyclical. We just didn't catch it in the right phase.
We'll have to do another UFC.
There's no time. We've got less than an hour to make a call.
If we treat for Cushing's and we're wrong, she's dead.
If we assume it's not Cushing's, she'll lose her breast and may still be sick.
Do an MRI.
You want us to look for hypercortisolism with an MRI?
No, I want you to look for what could cause hypercortisolism with an MRI.